Ondo State,
our health is our pride.
we got to say,
All and sundry, our health is our pride.
Ondo State,
Our health is our pride.
we got to say,
All and sundry, our health is our pride.
oh no story again. All eyes have seen, all mouth can tell. Ishe takuntakun of Ondo State government in a sector.
Now we've got the evidence to show all African nations that Governor Mimiko is truly making life worth living. Working every day, bring out the vision, reducing mortality.
Ondo State,
Our health is our pride.
we got to say,
All and sundry, our health is our pride.
Abiye program, mother and child hospitals, Ganifa when you meet diagnostic center in Ondo, eyeglasses distribution, festival of surgery in place, trauma and emergency center and care are in place.
Now we've got the evidence to show all African nations that Governor Mimiko is truly making life worth living. Working every day, bring out the vision, reducing mortality.
Ondo State,
Our health is our pride.
we got to say,
All and sundry, our health is our pride.
Good evening and welcome to our Health Our Pride, where we inform you of the giant stride of the Ondo State government in the health sector. I am Yewande Adidoku.
Our health, our pride.
Last week, we brought to your viewing pleasure the commissioning of the Mother and Child Hospital in Ondo. And due to overwhelming demand, we will again let you have another bite of the historic event. Let's have the shot.
Our health, our pride.
Available statistics today indicate that 54,000 Nigerian women die yearly of complications arising from pregnancy and childbirth. According to the reports, maternal death in Nigeria stands at about 800 per 100,000. In addition to this is the fact that 191 children die in every 1,000 births, one of the worst child survival rates in the world. This perhaps explains why Nigeria is also ranked 19th from the rear among 145 countries with highest infant mortality rates, as 900 in 10,000 children die under age 1, representing about 10% of the 5.2 million babies being born annually in the country. Unfortunately, Ondo State until year 2009 was also a major shareholder in this ugly scenario, as it topped the chart in the southwest on infant and maternal mortality rates. This is not unconnected with the fact that most women do not have access to reliable basic health facilities, and we are at the mercy of traditional and unskilled birth attendants as well as quack doctors. This certain situation, the Caribbean government of Dr. Olusegun Mimiko realized must be urgently dealt with, else the state will be in a messier situation in a few years to come. This was why government conceptualized the Abiye Safe Motherhood program, under which a resounding success was recorded at Ifedore, the pilot council area, before it was replicated in other council areas of the states. Also, as part of the Abiye strategy, government established a world-class and purposefully built mother and child hospital at Okearo in the heart of Akure to offer exceptional and qualitative services for pregnant women, nursing mothers and children under 5 years free of charge. Available statistics reveal that the hospital in less than 3 years has attended to over 60,000 patients, conducted no fewer than 15,000 deliveries with over 2,300 through cesarean section. Also, according to investigations, there has been a 44% increase in patient load and 14% decrease in maternal mortality rate compared to statistics in 2010 and 2011. The successful story and commitment of government to replicate the hospital in all senatorial districts led to the establishment of another one in Ondo to serve all communities and villages within its axis. The undoubtedly magnificent edifice today was as a result of months of toil, hard labor, and constant site visit by the Governor, Dr. Olusegun Mimiko, and the Commissioner for Health, Dr. Dayo Adeyanju. An outcome of that purposeful and determined commitment has given birth to another facility that had even become a tourist haven before it was commissioned. The hospital is in tandem with the Millennium Development Goals 4 and 5 to reduce child mortality by 67% and maternal mortality by 75% in Ondo State by 2015, as well as run an integrated, qualitative, critical and referral services. The 100-bed facility has an administrative section for about 14 offices for the hospital administrators, 50-seater seminar room, health information management library, sex consulting room, 4 nurses station, 4 medical laboratory services, and 4 outpatient pharmacy services. The theater wing comprises a 3-bed well-equipped intensive care unit, central sterilizing and general stores, children ward with recreational facilities, theaters, wards, among other facilities. The electricity supply of the hospital is provided by PACN and supported with a 250 kVA generator and 120 kVA UPS inverter. The larger road leading to the event was jam-packed as both human and vehicles competed for space while they awaited the man instrumental to putting Ondo State at the forefront of campaign against infant and maternal mortality in Africa. The excitement in the atmosphere was high, and the joy of the people knew no bounds as both traditional and different bands competed for attention.
Our health, our pride.
Little wonder that on arrival, the medical doctor turned politician with a caring heart had to trek meters to the hospital because of the traffic congestion and acknowledged cheers from the mammoth crowd that had come to witness the momentous occasion. The roll call of dignitaries was countless: traditional rulers, human rights activists, members of the diplomatic corps, development partners, members of the state executive council, politicians. The list is endless. And straight to business, the Commissioner for Health, Dr. Dayo Adeyanju, commended the governor for his exemplary leadership and support by the Maternal Pulse Foundation of his wife, Mrs. Olusegun Mimiko, which are greatly giving women and children in the state a sense of belonging.
This is further demonstration of the carrying out government to ensuring that pregnancy will never be a death sentence. The carrying out administration is reversing this totally unacceptable maternal and under 5 mortality with the launch of the Abiye Motherhood program and the Mother and Child Hospital in Akure, and the success of which informed the replication in Ondo and subsequent replication in other senatorial districts. So, Mr. Governor, as I welcome you, I also salute your political will, which is making all of this a huge success. And I also salute the wife of the governor for the support. To Mr. Governor, through maternal pause, you have been so supportive to our health sector. And I can see that the coast is expanding every day. This is another mother and child that will see to delivery of more babies. And beyond delivery, you have ensured that poverty does not take them away. We thank you and we appreciate you.
Dr. Abiye says the hospital was born out of the governor's commitment to ensure pregnancy is no longer a death sentence in the state.
This is a great improvement over what we have in Akure. As you realize, look at this, it's got 4 wings, and each wing has its own peculiarity. It is to have a one-stop shop where you can actually have access to an integrated healthcare, so that you don't have to be jumping from one building to the other. You see a doctor, you want to have investigation done, you want to be admitted, you want to take your medicine, you do everything in a one-stop shop that is integrated. That is the entire concept.
The development partners in the likes of UNICEF, the World Bank, and the Nigeria Governors Forum, who have already found a viable partner in Ondo State, advised other states in the country to take a cue from Ondo as to how best to achieve MDGs 4 and 5.
Ondo State is in the forefront in Nigeria of addressing issues of maternal, child, and health programs. And we know that you are using the strongest interventions to improve the health of mothers and children. Safe Motherhood program in Ondo State has been very, very successful, and it has reduced maternal and child health deaths.
Mr. Governor is paying attention to tertiary care, and we have MCH here, we have in Ondo. But we also want to partner with the governor at the primary healthcare level to make sure that in every nook and cranny of this state, women and children have access to good healthcare wherever they may be. Health is a human right, and every citizen of Ondo State deserves the right to good health. And we thank the governor for making this available to the citizenry. Mr. Governor, I say thank you very much for what you are doing.
Let me also use this opportunity to appeal to all the good people of this great state to support their governor in ensuring the full success of all this initiative. We should understand that the overall success of every genuine initiative put in place by a leader lies on its followership. It is said that only where there is a will that you find a way. It is my own belief that only where there is a solid commitment will there be a solid action which will eventually translate into solid outcomes. This is the prevailing ambience here in Ondo State today.
It is understatement that the Abiye program is the first of its kind in Africa. Is it in the world? And I remember vividly the day His Excellency presented this Abiye program to the World Bank headquarters in Washington. I remember how many mails we have received from our colleagues everywhere all over the world wanting to come and learn about Abiye program, and I think that is a kudo for the country, and it's a kudo for the state, and a kudo for our excellency. I thank you very much. You have been doing very well, and all I can always say is that we pray for you that whatever you lay your hands on to better to improve the life of the citizen of Ondo State, because that is the passion that you have, that God will see you through.
And for Governor Olusegun Mimiko, his joy today is that the unwholesome statistics his administration made in 2009 has today changed for the better.
You will recall that at the advent of this administration, we made a solemn pledge to positively touch the lives of these vulnerable members of our society. We promise to track all our pregnant women and children wherever they live, work and play, so as to cater for their unique health needs. We promise to remove all obstacles preventing interfacing between them and qualitative healthcare services. We promise to reverse the unwholesome trend that labels Ondo State as having the worst maternal and childcare indices in the southwest of Nigeria way back in the year 2008. Now 4 years on, with all sense of modesty, we are credited with having the best maternal and child health care program in Nigeria and perhaps beyond.
Governor Mimiku projected that at least 20,000 out of the 30,000 expected annual deliveries in the state will be at the 4 mother and child hospitals that will be strategically located in the state come 2015. He expressed optimism that the facility will surpass achievements recorded at the hospital in Akure and assured that his government will give the adequate support to the hospital backed with needed manpower and resources to excel.
The edifice that is before us this glorious day is a continuation of our 5-year strategic plan to replicate and sustain the provision of quality healthcare services for women and children across the state. The Mother and Child Hospital Ondo is a referral tertiary facility modeled after the one in Akure in terms of functionality with an identical mission statement to run an integrated maternal and child care facility fully poised to offer qualitative and critical interventions when required. This facility will not only match the enviable achievement of his predecessor, but surpass it in record time. I can confidently assure the management and staff of this facility of all our support as government in terms of manpower and material resources that will be required in making this a reality. As we strive to impact positively on maternal and childbirth health, it is of utmost importance that our pregnant women and children continue to avail themselves of services at this hospital and other Abiye centers located around the state.
The governor thereafter commissioned the hospital for the use of mankind. Governor Mimiku, accompanied by the dignitaries, were also taken on a tour of the facilities by the Commissioner of Health, Dr. Adeoju, and the Chief Medical Director of the hospital, Dr. Lawal Oyinayin. To the people of Ondo and its environs, the Magical Wand initiative of the Abiye Safe Motherhood program has finally hit the town in grand style. Congratulations to the pregnant women, nursing mothers, and children under 5 years.
To have this place as conducive, and of course, are my nurses.
The all nurses here. Yes. Are you excited? Yes. Ready to go? Yes. Who was in Akure here? You know the volume of work. It's going to be twice that.
Now we've got the evidence to show all African nations that Governor Mimiku is truly making life worth living. Working every day, bring out the vision, reducing mortality.
Ondo State,
our health is our pride.
we got to say,
All is hungry, our health is our pride.
Welcome back. I'm sure you agree with me that the hospital is indeed a world class.
Our health, our pride.
Still on the Mother and Child Hospital, the facility has begun to attract notable visitors, just like the golden egg that has no hiding place. Again, let's join our guide to show us those who can come in.
Our health, our pride.
Eminent Nigerians have begun to throng the newly commissioned Mother and Child Hospital, Ondo, to see for themselves the so much talked about world-class facility to offer qualitative, integrated and exceptional facility for pregnant women and children under 5 years. It was a story of the proverbial golden egg, which has no hiding place, and just the Mother and Child Hospital in Akure investigation review ranks high among the most visited health facilities by visitors from outside the country. Leading the pack this time around is Emeritus Professor of Medicine, Professor Oladapo Akikube, who was taken round the facility by the State Commissioner for Health, Dr. Dayo Adeoju, the internationally respected health expert, inspected facilities at 4 wings of the hospital, cutting across administrative, outpatients, inpatients, and theatre, after which he applauded the vision of the governor, Dr. Olusegun Mimiko, for establishing the hospital.
If you go around the various parts of this country, it's unique to have this kind of setup, mother and child. And of course, it's the level at which it's been taken now makes it really conducive to the consumers. And the international community would applaud this approach because there's a lot of think through. It's not just a question of automatic.
He described the facilities at the hospital as world-class, which will go a long way in reducing infant and maternal mortality in the state.
It's important for the country to have innovators, those who can adapt, not just adopt, okay? Who look at the environment, see what we need, because we're still very, very low in the rating for the various statistics, health statistics, okay? And the MDGs, the Millennium Development Goals, this is the kind of thing that is going to improve in terms of mortality and morbidity in children.
Our health, our pride.
Something wonderful, something that I did not expect to see in Nigeria. And seeing this, I think when it comes to mother and child, there is no point going anywhere outside Nigeria because this establishment should be able to look after any system, any problem that we have with our women. We can do it. I think the question now is to tell them. And what we'll find is that people will come not only from Ondo but from other places once they know that things like this exist. And I must confess, I have not seen anything so remarkable as we have here.
Our health, our pride.
The visit of these eminent personalities and more that would still follow is an indication of the fact that the initiatives and programs of the present administration in Ondo State will continue to attract commendation from far and near.
Now we've got the evidence to show all African nations that Governor Mimiko is truly making life worth living. Working every day, bring out the vision, reducing mortality.
Ondo State.
Our health is our pride.
We got to say,
all and sundry, our health is our pride.
Our health, our pride.
And that is the size of the show this evening. Thanks for joining our world. Stay fit and keep being healthy. Remember, our health is our pride in Ondo State. Thanks for watching.
Now we've got the evidence to show all African nations that Governor Mimiko is truly making life worth living. Working every day, bring out the vision, reducing mortality.
Ondo State.
Our health is our pride.
We got to say,
all and sundry, our health is our pride.